This is the eye treatment unit. So for level 2, for eye treatments, you will cover clusters and strips, tinting of lashes and brows, and reshape and tidy of the brows. I'm going to start off with contraindications. What is a contraindication? A contraindication is something that will stop you from doing a treatment, and a restriction is something that you're going to work around. So as we're working on the eyes, we're going to start off with conjunctivitis. Now this is an infection and it's very contagious. With conjunctivitis, your eyelids can look red and they can look sore. A stye, this is a small boil at the end of a hair follicle. It can be a little bit itchy, but again, it can be contagious, so make sure that you're not completing any treatment with anyone with a stye. Blepharitis, this is inflammation and redness of the eye. So depending on the severity will depend on whether you tell your client to go and see a GP, but this does need to be cleared before they come back for any eye treatment services. Watery eye, this is something again that won't necessarily be a contraindication, but can be a restriction. But definitely if they have severe watery eyes, it's going to hinder you putting your tint on, and it will affect the adhesion of the adhesive glue if you're applying clusters and strip lashes. Bruising of the eye. When you've got a bruised eye, it's again depending on the severity and pain that your client might be in, will depend on whether you can complete the service. Active eczema and psoriasis. This is when it's weeping, pussing, bleeding, maybe open. You cannot complete a service on that. It's only if the eczema is just slight dryness, or again the psoriasis, just manageable slight dryness or redness on the skin. Hay fever. You've just got to be more mindful with someone with hay fever. This is because their eyes are more prone to watering. They can find they're more prone to allergies. They're more sensitised. So anyone with hay fever, just side with caution. So some people might have had a recent operation around the eye area. They might find that they've had an accident, or they've cut themselves, or they might have had a piercing. So make sure you wait at least 6 months. This ensures that you're not reopening that scar. So like I mentioned earlier, restriction means you can work around it. So it's something that's not going to stop the treatment, you've just maybe got to adapt. So things like skin tags and moles, we mentioned bruising as well, these can all be worked around. But always remember the severity of everything will depend if it will stop a treatment or if you're working around it. So contractions are something that can occur during or after a treatment. So I'm going to expect erythema occurring during an eyebrow service or an eyelash. However, I don't want to be expecting any allergic reactions, any swelling, any itchiness, or anything that's going to cause my client discomfort. Always remove the product. If it happens after they've left you, then always advise, if they do have any problems, to go and seek medical advice. Always do a patch test. This is going to ensure that the client is compatible with the products that you're using and the treatment you are offering. If they are having a positive reaction, then please do not carry out the treatment at all. And you can always alternatively find an alternative product that might work for them, but do not carry that treatment with the product that's caused them a positive reaction. Patch testing should always be done 24 hours to 72 hours before a treatment, never any longer. And you'd always pop it behind your ear or in the crook of your elbow, and make sure you record all of the dates down along with the signature as evidence. Again, advise your client, a little bit of redness is fine, but any itchiness, swelling or discomfort, then that will show to them that they're going to have a positive reaction to this and they're going to have an allergy to the treatment. So if the client has had a negative reaction, you can follow on with the treatment. And if you haven't carried out a patch test, unfortunately, you should not carry out the treatment, and you might be liable to legal action taken against you should they have a reaction without a patch test being taken. So eyelash and eyebrow tinting. Now tinting comes in a variety of colours. You've got blue, black, brown and grey, and they're your typical colours that you find. Sometimes you'll get blue, black mixed in the same tube, or sometimes you've got to mix blue and black together. Depending on your client's skin tone and hair colouring will depend on the type of tint colour you're going to be using and how long you're going to be leaving the tint on for. So why do people get tints? So people like to have eyelash tinting eyebrow tinting if the hairs are not visible. To add depth to your features, you may be going on holiday, making your lashes look longer, or someone that just doesn't like to wear makeup but still wants to have them features defined. So when you're mixing up the tint, you need to make sure that you're following manufacturer's instructions. They do vary. Typically you get a 5p piece and you have 8 to 10 drops of the peroxide. So you have a little bit of tint, the peroxide, and mix this together in quite a thick consistency. Now this has to be done at the time of application. You should not mix up your tint at the beginning of the day or before the treatment, because that process is called oxidization, and oxidization is when the colour is developing. So if I mix this up at the beginning of the day and then apply it onto my client, it very may well tint the hair, but it wouldn't be for long. Or you might find it doesn't tint the hair at all. So please make sure tint is mixed at the time of application. Always make sure you mix your tint well, but please remember to read the instructions as mentioned earlier, as the peroxide amount will change. So when you're looking at eyes and the eye shapes and how you're going to shape the brow will depend on your features. So we may look at the face shape, but we need to look at the eye positions and the eye shapes that you have. So when you've got a wide set eye, you need to bring the inner bits of your eyebrow closer together, and when you've got a close set eye, you need to start them further apart, and this gives the illusion that your eyes are not so close or wide set. Now here in the diagram you can just see an exaggerated picture of what an eyebrow should look like. This will help understand how your eyebrow should be shaped per the face shape. However, please, like I just mentioned, please consider the eye shape too, as this is quite a big influencing factor. So with men's eyebrows, they're a lot more bushier, a little bit more hairier, and a little bit more undefined than women. Men are taking more interest in grooming and taking more pride in how their eyebrows look. So during that consultation, really find out, do they want a more natural look or more defined look? Defined look, you take the same steps as you would as a female. But if they just want more of a natural look, you're just removing a few hairs, making sure you're trimming the hairs, making them look a little neater, but not changing the shape too much. But that is a key discussion that you need to have during your consultation. When doing eyebrows, always make sure that you measure, and we'll be looking at the measurements further in on this unit. So eyelash extensions. For level 2, you only are be doing the clusters and the strips. Looking at the clusters, these are the nearest step or the next step before you go and get your individual lash extensions. Now this is on a bead with about 3 lashes from it, and you apply this onto your lashes to give you a more fuller look. The strip lashes are easier to apply. Most people apply them themselves. Now with clusters, they last a little bit longer. Strips, they normally only last for that day. Both enhance your lashes, making them thicker and fuller. People who have these type of eyelash extensions might need them for the prom, weddings, or any events that they're going to. But always remember, you need to ask certain questions about if the durability, how long they want something on, what they want to achieve, as this will help determine whether you're going to go for a cluster or a strip. So looking after your lashes is really important, because if you don't, then they can damage your natural lashes. So making sure you're not pulling them, you're not rubbing them. Also making sure that you're getting them removed professionally. These are specific to clusters. The glue is slightly stronger, whereas strip lashes, the glue is a lot weaker, so you tend to find that clients do remove them. But again, do not pull, and make sure that you're not ripping them out. If you do want to remove them, then use an oily makeup remover. If you want them to stay, then use a non-oily makeup remover, as the oils will break down the adhesive, causing the lashes to lift from your natural lashes. If you need to, brush your clusters, as sometimes they can get a bit tangled. And make sure that you sleep on your back too if you're sleeping with them overnight. Eyebrow measuring. So as you can see in the picture, you measure this into 3 sections. You've got the inner corner, the middle and the outer corner. So you make sure that it measures up on the corner of your eye. When working out where your arch is, you will always measure this through the center of your client's eye when she's looking or he's looking up. if by any chance your eyebrows don't meet the measurements equally, you need to explain this to the client and discuss some other eyebrow options that they could have to make sure that the eyebrows suit the client's face and features correctly.